I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today, I'd like to introduce Dr. Levin. Dr. Levin is a pediatric infectious disease specialist and the medical director for the Ventura County of Public Health. Welcome.
It's good to be here.
Thank you. Let's start by defining influenza. What exactly is influenza?
Influenza is an infectious disease. It's caused by a virus. It's unusual in that regard because it's one of the few infectious diseases caused by a virus that actually has a treatment for it. There are drugs that are pretty effective against it. One of the characteristics of influenza that distinguishes it from something like the common cold is that it's really serious. When you have the flu, for the most part, most people are really knocked flat. They have chills and fever. They have a bad cough usually, oftentimes a sore throat. And you do not want to leave the house. You feel miserable, and it lasts for days. Even in the United States, and even with the fact that we have immunizations, we still see hundreds of thousands of people hospitalized with influenza every year here in the United States. And we see anywhere from 3,400 to 49,000 people die each year in the United States. If you do get the flu after having the flu vaccine, it is likely to be milder than it otherwise would have been. It doesn't last forever. We need to get this vaccine every year. Another side effect of the vaccine is the side effects of the vaccine. And they tend to be pretty mild in general. And it's important when we're thinking about vaccines to compare the side effects of the vaccine not to not getting the vaccine. The side effect of the vaccine should be compared to the side effects of the disease that you're avoiding when you get the vaccine. The side effects you get from the injectable are pretty much the same as you get with any of the other injections. There can be soreness, there can be a bit of swelling, there can even be sometimes fever associated with it. And that's why it's really wise, after you get your shot, to take a dose of Tylenol. The side effects of the nasal spray, which, as you rightly point out, is a live virus, can be very much more in the category of having a very, very minor cold. So you might get a little bit of a runny nose following that, or even a low-grade fever.
I like to point out to my patients that most often the side effect associated with vaccine is none. Usually you don't see anything. You don't see fever, you don't see soreness, you don't see anything. And yes, there are a handful of people who can get these, but primarily most people don't have any problem with the vaccinations.
That's been my experience.
How about for protecting little babies? Because there currently is no vaccine that is approved for children under 6 months of age. What are we going to do to protect these little ones?
Well, the vaccine, as you're implying, is not to be given until someone gets to be 6 months of age, and then it can be given throughout the rest of the lifespan. But in the first 6 months, the best way to protect a baby, and we all have a responsibility in this, is to make sure that the mom is fully vaccinated against all diseases, but you can give a pregnant woman the injectable vaccine during her pregnancy and at any stage in her pregnancy. And that will give her antibodies, and her antibodies are shared across the placenta with the baby. And those antibodies tend to run for anywhere from 6 months to 18 months inside the newborn. And so that baby will be protected until we can give the baby's first vaccine at 6 months of age. Now, the other way of protecting a baby, and this is as important as well, is to make sure that the people that are around that baby, siblings, parents, grandparents, those people that will be holding and cuddling that baby, are also immunized.
So basically, we're creating a globe around that child of people who are protected against influenza. And then the baby is getting a secondary gain by being protected by this.
And it actually has a name. It's called cocooning.
There we go. Okay. Who would have thought it? We've changed our guidelines over the years. We've gone from protecting high-risk individuals and babies and those with asthma, elderly, others, to basically recommending that anyone above 6 months of age be vaccinated against influenza. Have we seen a shift in the rate of influenza in the community because of this policy change?
We don't know. And the reason we don't know is because influenza is not a reportable disease. There are only aspects of influenza that are reportable. If you're under 65 and you die of it, that's reportable. If you're under 65 and you're admitted to an ICU, that's reportable. And if there's an outbreak in an institution like an extended care facility, that's reportable, but other cases are not.
So it looks like there's a lot more tracking that we need to do to try to figure out what's going on, and it sounds like trying to get more places and more offices to participate in tracking is one of the things that will help with that.
Yeah, but we do know the other side of the equation, and that is if you get the immunization, you're less likely to get it.
Got it. Interesting. I would like to thank Dr. Levin for joining me in discussing influenza. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com. And remember, at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ears.